15 minutes of sauna activates the exact same cellular repair pathways as 48 hours of fasting. Introduction. Recent studies have illuminated the potential health benefits of sauna bathing, suggesting that even short sessions can evoke significant physiological responses similar to those seen during prolonged fasting. This summary explores the findings that just 15 minutes in a sauna can activate cellular repair pathways akin to those activated by 48 hours of fasting. Cellular repair mechanisms. Both sauna exposure and fasting induce a state of stress in the body, prompting cellular repair mechanisms. Key pathways activated during these conditions include heat shock proteins (HSPs). These proteins help protect cells from stress and are essential for protein folding and repair. Insulin sensitivity enhancement. Both practices improve the body's response to insulin, which is crucial for glucose metabolism. Mitochondrial function. Enhanced mitochondrial function leads to better energy production and reduced oxidative stress. Health benefits of sauna. Research indicates numerous health benefits associated with regular sauna use. 1. Cardiovascular health. Regular sauna bathing has been linked to lower blood pressure, improved vascular function, and reduced risks of cardiovascular diseases, including sudden cardiac death. 2. Cognitive benefits. Frequent sauna use is associated with a lower incidence of dementia and Alzheimer's disease. 3. Muscle recovery. Athletes benefit from sauna sessions, which can enhance recovery and plasma volume after exercise. For psychological well-being, saunas have been found to decrease anxiety, promote relaxation, and improve overall mood through the release of endorphins. Comparison of sauna and fasting. While both sauna bathing and fasting activate similar biological pathways, there are notable differences. Accessibility. Sauna sessions can be easily integrated into daily routines, while fasting requires abstaining from food, which may be more challenging for some. Experience. Sauna bathing can provide immediate relaxation and pleasure, whereas fasting may involve discomfort due to hunger. Safety and risks. Though generally safe, sauna use can pose risks, particularly for individuals with certain health conditions, e.g. cardiovascular diseases. Mild adverse effects are occasionally reported, such as dehydration or lightheadedness, but severe incidents are rare. Comparative insights from various sources. Philosophical implications. Discussions on platforms like Twitter highlight the philosophical concerns surrounding biological responses to environmental stressors such as heat and fasting. Podcast insights. Experts emphasize the importance of understanding metabolic cycles and the nuanced roles of growth factors like IGF-1 in relation to sauna and fasting. Systematic reviews. A comprehensive review of sauna studies indicates strong evidence supporting its health benefits, particularly in cardiovascular and cognitive domains. Historical context. Sauna bathing has been a cultural practice for centuries, evolving from traditional methods to modern-day facilities that offer varied experiences. Recent studies 2000 present have increasingly focused on the physiological effects of saunas, emphasizing the need for further research into optimizing sauna protocols for specific health outcomes. Conclusion. Sauna bathing presents an accessible and effective means of activating cellular repair pathways similar to those achieved through fasting. The health benefits combined with its psychological advantages suggest that incorporating sauna sessions into regular health routines may enhance overall well-being. Further research is essential to explore the long-term effects and optimal practices for sauna use, especially in relation to specific health conditions. This report highlights the significant parallels between sauna use and fasting regarding cellular repair mechanisms and overall health benefits, emphasizing the need for continued exploration in this fascinating area of health research. The assertion that 15 minutes of sauna use activates the same cellular repair pathways as 48 hours of fasting is striking and counterintuitive for several reasons, primarily because fasting is often viewed as a more rigorous and impactful method for promoting cellular health compared to passive heat exposure. Here are some key points that highlight the counterintuitive aspects of this claim. 1. Simplicity versus effort. Fasting generally requires significant self-discipline and abstention from food, which can be challenging for many people. In contrast, using a sauna for a short duration is often a more accessible and less demanding practice. The idea that such a simple, comfortable intervention could yield similar cellular benefits as an arduous fasting regimen runs counter to typical expectations about health interventions. 2. Mechanisms of action. Both sauna bathing and fasting promote cellular repair mechanisms. But the pathways they activate differ. Fasting is known to enhance autophagy and induce ketosis, leading to various metabolic adaptations. Sauna use, on the other hand, triggers heat shock protein production and enhances mitochondrial function. The overlap in benefits suggests that the body may have alternative, less expected methods for achieving cellular repair, complicating the common narrative that fasting is superior for health improvements. 3. Cultural perceptions. Fasting is often steeped in cultural and historical significance associated with various spiritual and health practices, while sauna use is typically viewed as a form of relaxation or leisure. The idea that a form of luxury can produce similar health outcomes as a traditionally revered health practice challenges preconceived notions of what is necessary for health benefits. 4. Accessibility and inclusivity. The ease of sauna use means it can be more widely adopted across various populations, including those who may struggle with the demands of fasting due to health issues or lifestyle. This could shift public health messages towards promoting heat exposure as an alternative to fasting, which might be unexpected for those who prioritize fasting as a primary health strategy. 5. Safety concerns. While both fasting and sauna use are generally safe for most people, they do come with their own sets of risks. Fasting can lead to potential nutritional deficiencies or metabolic issues if not done properly, while sauna use can pose risks for individuals with chronic illnesses or cardiovascular conditions. The equivalence in health benefits might lead some to overlook the nuances and potential risks associated with either practice. 6. Psychological effects. The mental health benefits associated with sauna use, such as reduced anxiety and improved mood, may not be as readily acknowledged as those linked to fasting. Fasting is often framed in terms of discipline and self-control, while sauna use may be seen as indulgent. This difference in perception could lead to a misunderstanding of the holistic benefits of both practices. 7. Longevity and health span. The connections made in research between sauna use and increased longevity or reduced incidence of diseases such as dementia and cardiovascular conditions challenge the notion that only caloric restriction or fasting can lead to significant health span improvements. This could redefine how individuals approach their health strategies, integrating saunas as a viable alternative to fasting. 8. Scientific validation. The emerging body of research supporting the benefits of sauna use raises questions about long-held beliefs in nutrition and health. It suggests that interventions previously considered secondary or adjunctive, like sauna bathing, may deserve more attention, fundamentally altering the landscape of health recommendations. In summary, the assertion that sauna use can replicate some of the cellular benefits of fasting is counterintuitive because it challenges established beliefs about the complexity of health practices, the effort required for optimal health, and the accessibility of different health strategies. This finding invites a re-evaluation of how we view and recommend lifestyle interventions for health and longevity. Key insights from the report on sauna use in fasting. The research detailing the benefits of sauna use reveals significant insights that could easily be overlooked by readers. Here we will dive into those aspects, emphasizing their importance. 1. Cellular repair pathways activation. Overlooked insight. The report highlights that just 15 minutes of sauna use can activate cellular repair pathways akin to those activated during 48 hours of fasting. Significance. This finding emphasizes the potential of sauna therapy as a practical alternative to fasting, which can be difficult for many people to sustain. The activation of heat shock proteins, insulin sensitivity, and mitochondrial function are crucial for cellular health and longevity. This opens avenues for individuals who may struggle with fasting but can incorporate sauna sessions into their routine. 2. Psychological benefits. Overlooked insight. The psychological effects of sauna use, such as reduced anxiety and improved mood due to endorphin release, are significant yet often overshadowed by physical health benefits. Significance. Mental health is increasingly recognized as pivotal to overall well-being. The ability of sauna sessions to enhance mood and reduce stress may offer a non-pharmaceutical approach to managing mental health, particularly beneficial in today's high-stress environment. 3. Comparison of sauna and fasting. Overlooked insight. Fasting requires significant discipline and may not be accessible for everyone. In contrast, sauna use can be integrated into daily life with relative ease. Significance. This comparative analysis is critical as it frames sauna use as a feasible health intervention. The ease of access could lead to broader adoption and potentially significant public health benefits, particularly in populations where chronic diseases are prevalent. 4. Synergy with exercise. Overlooked insight. Sauna use after exercise can enhance recovery by increasing plasma volume and improving hydration status. Significance. For athletes and active individuals, the synergy between sauna therapy and physical exercise enhances performance and recovery. This is particularly relevant for training regimens, suggesting that sauna use should be considered a complementary recovery tool. 5. Adverse effects and safety considerations. Overlooked insight. While sauna use is generally safe, mild adverse effects can occur, particularly in vulnerable populations. Significance. Understanding the potential risks associated with sauna use is essential for informing individuals, especially those with pre-existing conditions. This knowledge empowers people to make informed decisions regarding their health practices. 6. Long-term health outcomes. Overlooked insight. The research indicates decreased risks of cardiovascular diseases and dementia from regular sauna use, with substantial evidence from population studies. Significance. These long-term health outcomes highlight sauna bathing as a preventive health measure. The implications for aging populations and those at risk for chronic diseases are profound, suggesting that regular sauna use could be a lifestyle change with significant health benefits. 7. Accessibility and cultural factors. Overlooked insight. The cultural history of sauna use in various societies illustrates its potential acceptance as a mainstream health practice. Significance. Recognizing sauna bathing as a traditional practice in many cultures can aid in its promotion as a health intervention. This cultural context can enhance its acceptance and encourage individuals to adopt sauna use as part of their health regimen. 8. Mechanisms of action. Overlooked insight. The report discusses complex mechanisms by which sauna induces benefits, including hormonal and vascular responses. Significance. Understanding these mechanisms can lead to more personalized health interventions utilizing sauna therapy, particularly for cardiovascular and metabolic health. 9. Detoxification claims. Overlooked insight. The report mentions the detoxification claims related to sauna use, which are often met with skepticism due to lack of solid evidence. Significance. While the detoxification potential of sauna use may require further investigation, it remains an attractive aspect for many individuals seeking holistic health approaches. This nuance can guide future research directions. 10. Impact on hormonal regulation. Overlooked insight. Sauna use appears to influence hormone levels, including those related to stress and metabolism. Significance. Hormonal balance is crucial for numerous bodily functions. Understanding how sauna therapy interacts with hormonal regulation can lead to innovative applications in treating conditions related to hormonal imbalances such as metabolic syndrome. In conclusion, while the report presents substantial evidence on the benefits of sauna use and its physiological parallels to fasting, the overlooked insights provide depth to the understanding of sauna use as a holistic health intervention. Recognizing and emphasizing these insights is crucial for both individuals and healthcare professionals aiming to optimize health and wellness strategies. 4 most valuable points for in-depth analysis and discussion. 1. Cellular repair mechanisms. Overview. The research indicates that both sauna use and fasting activate similar cellular repair pathways that promote health and longevity. Key mechanisms include the production of heat shock proteins, improved insulin sensitivity, and enhanced mitochondrial function. Discussion points. The role of heat shock proteins in cellular repair and their potential implications for longevity. Comparisons between the physiological effects of sauna use and fasting, drawing on studies that highlight the similarities and differences. How these cellular repair mechanisms could be leveraged in clinical practices, especially for aging populations or individuals with metabolic disorders. 2. Cardiovascular health benefits. Overview. Regular sauna use has been linked to numerous cardiovascular benefits, including lower blood pressure, improved vascular function, and reduced risk of diseases like dementia and Alzheimer's. Discussion points. Analysis of systematic reviews and clinical studies that quantify the cardiovascular benefits of sauna use, focusing on specific metrics like blood pressure and heart rate variability. The potential for sauna therapy as a complementary treatment for patients with cardiovascular diseases, particularly in populations that may struggle with traditional exercise regimens. Consideration of the long-term implications of sauna use on overall cardiovascular health and mortality rates, supported by large cohort studies. 3. Psychological and emotional effects. Overview. Beyond physical health, sauna bathing has been associated with psychological benefits, including reduced anxiety and improved mood. The release of endorphins during sauna sessions contributes to these positive outcomes. Discussion points. Explore the neurobiological underpinnings of how sauna bathing can lead to improved mental health outcomes. Discuss the implications of sauna use for stress management in contemporary life, especially in high-stress environments. Investigate how sauna culture and social interaction during sauna sessions might further enhance its psychological benefits. 4. Comparative accessibility of sauna versus fasting. Overview. While both sauna use and fasting provide health benefits, their accessibility and ease of integration into daily routines differ significantly. Sauna sessions can be more easily incorporated into lifestyle changes compared to fasting, which may pose challenges for some individuals. Discussion points. Examination of the barriers to fasting as a health practice compared to the more universally accessible nature of sauna bathing. Discussion on how to encourage sauna use as a viable alternative or complement to fasting for those seeking health benefits without the restrictions of dietary changes. Policy implications regarding public health recommendations, especially in promoting sauna use in community wellness programs or healthcare facilities. Conclusion. These 4 points provide a comprehensive framework for analyzing and discussing the multifaceted health benefits of sauna use in comparison to fasting. The exploration of cellular mechanisms, cardiovascular health, psychological effects, and accessibility can lead to valuable insights for both clinical practices and public health policies. Future research should focus on further elucidating these benefits and optimizing sauna protocols for specific health outcomes. 3 famous historical cases similar to sauna and fasting research. 1. The use of fasting and heat therapy in ancient Greece. In ancient Greece, both fasting and heat therapy were integral parts of wellness and healing practices. Notably, Hippocrates, often regarded as the father of medicine, emphasized the therapeutic benefits of fasting to treat various ailments. He believed that abstaining from food allowed the body to heal itself and recover from illnesses. Alongside this, the ancient Greeks also utilized steam baths and hot springs for their health benefits, which are similar to the modern practice of sauna bathing. These treatments were thought to promote detoxification, improve circulation, and enhance overall health. Mirroring the contemporary findings that link sauna use and fasting to cellular repair and longevity. 2. Tibetan Buddhist practices of meditation and heat exposure. Tibetan Buddhist monks have long practiced forms of meditation that involve exposure to extreme temperatures, both hot and cold, as part of their spiritual and physical training. These practices, known as tummo, involve generating bodily heat through meditation, allowing practitioners to endure cold temperatures without discomfort. Research has shown that similar physiological responses occur during heat exposure in saunas, such as the production of heat shock proteins and improved cardiovascular function. The underlying principles of hormesis, or mild stressors like heat or fasting, confer health benefits, are evident in both ancient Tibetan practices and modern sauna and fasting studies. 3. The Roman baths and their health benefits. The ancient Romans were famous for their public baths, which were designed not only for hygiene but also for relaxation and health benefits. The baths typically included various heat levels and humidity akin to modern sauna practices. Romans believed that bathing in hot water could cure ailments, improve circulation, and promote overall wellness. Additionally, fasting was also practiced among some Romans for health reasons, particularly during religious observances. Archaeological and historical evidence suggests that these practices were rooted in an understanding of the body's need for balance and the benefits of both heat and dietary restraint, paralleling the modern scientific findings regarding saunas and fasting. These historical contexts highlight the long-standing recognition of heat exposure and fasting as beneficial practices for health and well-being, which align with contemporary scientific research suggesting similar physiological and psychological benefits from sauna use and fasting. Future outlook, predictions for sauna and fasting research and practices. The findings that just 15 minutes of sauna use can activate similar cellular repair pathways as 48 hours of fasting is a significant breakthrough in the field of health and wellness. This revelation opens up numerous avenues for future research, lifestyle practices, and health interventions. Here are the predictions and potential developments we can expect in the coming years. 1. Increased popularity of sauna as a health intervention. As awareness of the health benefits of sauna use grows, we can anticipate a shift in public perception. Saunas will become more mainstream, not only as a luxury amenity but also as a recognized health intervention. Health clubs, spas, and wellness centers may begin to integrate sauna use into their offerings, positioning it alongside traditional exercise programs. 2. Research expansion and clinical trials. The current findings will likely spur further research into the biological mechanisms underpinning the benefits of both sauna use and fasting. We can expect a surge in clinical trials exploring the long-term effects of sauna therapy on various health conditions, particularly cardiovascular health, neurological diseases, and metabolic disorders. Researchers will delve deeper into understanding how heat stress induces hormesis and enhances cellular repair mechanisms. 3. Integration into medical practices. As more evidence emerges about the health benefits of sauna use, healthcare providers may begin to incorporate sauna therapy into treatment plans for patients with chronic conditions. This could particularly apply to patients with cardiovascular disease, diabetes, and mental health disorders, where sauna therapy could be used as a complementary approach alongside conventional treatments. 4. Personalized health protocols. With advancements in personalized medicine and technology, we may see the development of tailored health protocols that include sauna use based on individual health profiles. Wearable technology will likely play a role in monitoring physiological responses to sauna sessions, allowing individuals to fine-tune their sauna usage for optimal health benefits. 5. Sauna and fasting synergy. The relationship between sauna use and fasting will likely be explored further, with potential synergistic effects on health outcomes. Research may focus on how combining these practices can enhance cellular repair, improve metabolic health, and promote longevity. Wellness programs that integrate both sauna sessions and intermittent fasting could emerge as popular health trends. 6. Education and awareness campaigns. Health organizations and wellness advocates may initiate campaigns to educate the public on the benefits of sauna use and fasting. Workshops, webinars, and community programs could be designed to teach individuals how to safely incorporate these practices into their lifestyles, emphasizing their potential to improve overall well-being. 7. Technological advancements in sauna design. As the demand for saunas increases, we may see innovations in sauna technology. New designs could emerge that enhance the sauna experience, including smart saunas equipped with temperature controls, humidity settings, and integration with health monitoring devices. Infrared saunas may also evolve to become more efficient and accessible. 8. Focus on mental health benefits. The psychological benefits of sauna bathing, such as stress reduction and improved mood, will likely gain more attention. Research into how sauna use affects mental health could lead to its inclusion in therapeutic regimens for anxiety, depression, and stress-related disorders. This focus may position sauna therapy as a holistic approach to mental health care. 9. Global trends and cultural integration. As sauna practices are deeply rooted in various cultures, e.g. Finnish Russian, we may see a global exchange of sauna practices and traditions. This could lead to diverse sauna experiences that incorporate local customs, enhancing the cultural significance of sauna use. 10. Long-term health monitoring and data collection. As more individuals adopt sauna use as a regular practice, there will be an increasing emphasis on long-term health monitoring. Data collection on health outcomes associated with regular sauna use will help establish a clearer understanding of its benefits and any potential risks. This data could inform public health guidelines and recommendations. Conclusion. The future of sauna and fasting research holds immense potential for transforming our understanding of health and wellness. By integrating these practices into mainstream health interventions and leveraging technological advancements, we can enhance individual well-being and potentially reduce the burden of chronic diseases. As research progresses, the relationship between sauna use and fasting will provide exciting opportunities for new health strategies aimed at promoting longevity and improving quality of life.